right, welcome back to The Big Picture. It is 9:41 on your Wednesday. There's been a lot of talk about GLP-1 medications and how they're being used for weight loss, but the big question is, will they ever, depending on your insurer, if you're on state insurance, if you're on private, there's always the question of, will it be covered? So right now we are joined by Christina Regg from the Ohio Department of Insurance. Christina, thanks so much for coming in and talking with us.
All right, so walk us through this program that's going to be a demonstration over the next year and a half.
Yeah, right now, this is available for Medicare beneficiaries. So Medicare is health insurance for those typically 65 and older, any age if disabled, and those with permanent kidney failure. If you're on Medicare and you have Medicare Part D, currently, we're past July. Previously,
aren't we?
Medicare Part D only covered the GLP-1s for individuals with diagnoses that warranted it. This bridge program, or this demonstration for the next year and a half, will open up prescriptions for GLP-1s for those who only need it for weight loss.
This is, it all started out for diabetes. I really would say over the last 2 years, it's grown so much, and we've seen so many people using it for weight loss. Is that what you guys are seeing as well? People wanting to turn to it for a weight loss option?
Yeah, our program at the Department of Insurance provides objective and unbiased information for Medicare patients and their families. And for years, we fielded calls from individuals who didn't meet the medical need for these medications, but wanted to obtain them. So this is an opportunity for them to work with their providers, get that prescription, and have them covered for weight loss.
So what makers will be covered? We know there's like Eli Lilly, Wegovy, Zepbound. It goes on and on and on.
It goes on and on. So for this particular program, they're going to cover the Foundayo tablet. They're going to cover the Wegovy injection or tablet and the Zepbound Quickie pen. So those are the ones that were chosen for this particular demo. Doctors would be aware to prescribe those particular medications. But the Ozempic, the other forms of Zepbound, and other GLP-1s would not be included in the bridge.
And, these are fairly expensive medications because we hear from people who maybe are on private insurance and their insurance, maybe Anthem Blue Cross Blue Shield doesn't cover it in that instance, and people are paying significant amounts of money per month. Under Medicare, what would people still have to pay out of pocket for this?
So under this bridge program, it would be limited to a $50 copay for a 1-month supply. They'll only do it 1 month at a time. But I do want to preface, if individuals are receiving the GLP-1 prescription because of a medical diagnosis, type 2 diabetes, fatty liver, sleep apnea, that's actually going through their Medicare Part D prescription drug coverage, whether it's standalone or through an Advantage plan. So their copays would be determined by that plan. But for individuals who need it strictly for weight loss and qualify through the Bridge program, it's limited to $50 per month.
Do you have a lot of people reaching out trying to figure out how to get covered right now? Is that the whole point of all of this?
We're starting to get questions. It's a very new program. It just started July 1st. And of course, with the holiday, we might have a little slow start, but we are starting to see more and more calls, not only from the beneficiaries themselves, but providers, in making sure that this process happens appropriately.
Yeah, and I guess, because there are the different parts of Medicare that you kind of have to know once you hit that 65 age limit. When it comes to the Ohio Department of Insurance and your role at the Ohio Senior Health Insurance Information Program, when it comes to parsing out which part do I enroll in, how do I figure out and navigate that program, when people call your office, how do you walk them through what is best for them?
In many ways. Every state, every U.S. territory has a program like ours, either situated in their Department of Insurance or the Department of Aging. In Ohio, we're very fortunate to be a division of the Department of Insurance, a little bit closer to the pulse and the regulatory. But individuals, their family members, caregivers can call us with any type of questions they have about Medicare. Our role, again, is to provide objective, unbiased information about all those options, particularly those that are new to Medicare, making that initial decision on how to get their coverage. We are not going to tell somebody what to do. Our goal is that they make an educated decision based on their individual needs, their providers that they want to continue to see, their resources that they're able to afford. And hopefully they make wise decisions, and we'll be there to support them after.
Do you know how many people over 65 who are on Medicare are using GLP-1s?
I don't have that
Okay.
specific number at this time, but it's interesting because Ohio is the 6th most populous state for Medicare patients. We have over 2.6 million Medicare beneficiaries in the state of Ohio. So at this point, under Medicare, it would be those that have the diagnoses of diabetes, sleep apnea, fatty liver. But I imagine with this program, that number will increase.
It's so interesting too, hearing like there's the tablet option now. That's new. You know what I mean?
Yeah.
Just keeps developing and developing.
And we know this bridge program right now, it is through the end of 2027. What happens if that coverage is not extended? Basically that, Congress lawmakers decide that we're ending this December 31st, 2027.
Anything could happen, right? January 1st, 2028 is a very long time away. But the idea is, and Medicare CMS anticipates that this bridge program, this demonstration, will bridge us to what they're calling a balance program, where the GLP-1 is included for weight loss in the general prescription drug coverage.
Okay. Very interesting. I could talk about GLP-1s all day.
Is there
They're so
anything
amazing.
else that, folks out there should know, whether they're on Medicare or their parents are getting ready to go on it or on it, when it comes to, navigating really this new frontier of what's next?
Yeah, I always say start with your SHIP program, the objective information. We can guide you through that. With regards specifically to the bridge program and GLP-1, if you're on Medicare and you have a Medicare Part D plan, you want these medications strictly for weight loss, the first stop is your provider. Getting that prescription for the covered medications, getting it to the pharmacy. The pharmacy will submit that. It'll trigger the provider to provide prior authorization, and then it would be covered. They'll get a letter in the mail. Now, we're often eager to throw mail away, so you'd want to watch for something that came from Medicare, which is the Center for Medicare and Medicaid Services. When you get that letter, you can go to the pharmacy and get it filled. It seems like a lot up front, but once you get through that initial prior auth, it's good for the next 18 months. That'll take you through the end of the demonstration.
Wow.
Okay. All right, Christina, thanks so much for joining us and kind of breaking down what this means for
Thank
the
you
folks
for
affected.
inviting me.
Definitely a lot of information there. All right.